If you struggle with dementia, memory problems, or focus and attention issues, then watch this video to learn what 2 muscles you need to exercise to improve your brain function. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So these 2 muscles are critically important, and it's not your biceps, it's not your hamstrings, it's not even your abs for a six-pack. It's the superior and inferior oblique muscles inside of your eye. So without question, our eyes are the biggest sense and the biggest input into our brain. Fast movements fire the front part of our brain called our frontal lobe. Slow eye movements fire the back part called the parietal lobe. Our superior visual field is due to our temporal lobes. The inferior visual field that we see is due to our parietal lobes. And our occipital lobes are our primary vision centers. So every single part of the brain is affected by our sight and our vision, and making sure that we're exercising these 2 muscles is critical to improving our memory, our cognition, our focus, our attention, everything. So these 2 muscles are critically important for vertical eye movements, so looking up and down. They assist in that, and they also assist at looking at left and right. So what's really important with these muscles is making sure you have the not only full ranges of view in all these things, but also the ability to track things and the ability to move left, right, up and down in a full scale and fixate on things as well. So being able to look at a target and not keep your eyes from moving off of it. So what we often see with our folks that have problems with, say, focus, attention, or even later on what will be classified as dementia and the symptoms of that, is these folks tend to have weaker visual fields looking up first. And this is a signal into the brain that there is a dysfunction happening, because what starts to happen is first they cannot look up, and then give it 5, 10, 15 years, what starts to happen is that causes the head to come forward after a certain amount of time. So this is a whole gradual process that I'm accelerating here. But what happens is the head starts to come forward because they're trying to compensate for being able to look up and down, because they can no longer have this full ranges of motion here to see in their whole visual fields. And this gives us a really good window of what's happening, because as the head starts to come forward and the eyes can no longer look up, they're not stimulating the front part of the brain here called the frontal lobes, which its primary job is to turn on your extensor musculature, allowing you to stand upright. So if you are starting to come forward this way, then you're not able to fire the extensor muscles to keep yourself upright, which is going to cause obviously neck pain, upper back pain, and can potentially even cause lower back pain. But it's also our window into seeing how well the brain's functioning in terms of things like memory, cognition, even basic functions like heart rate and breathing and digestion, because all that's going to be primarily controlled up here through what's called your parasympathetic or relaxation nervous system. So it's also really important with these muscles too is being able to look left and right, because this is primarily how we read things when we read from left to right, but also when we're driving, looking around on the road, even when we're doing other things that are up close to us. So being able to look at things left to right is really, really important, because that increases our visual field, which again is another sign, another of how healthy your frontal lobes are, because the bigger your peripheral vision is, the healthier that your brain is. So in order to exercise these muscles and why you want to, so if you have problems with focus or attention, primarily what you're going to want to do is work on fixation and work on movements, slow movements up and down, and then fast movements left and right, because you want to be able to fixate on things as they come down and as they come up, and then fast as they come left and right, because you want to stimulate the front part of your brain here. Now, all this is going to be very much dependent on you, because of how this is going to affect the right and left frontal lobes. So you want to make sure you have a practitioner who's going to guide you through these to know which ones you need to do more of versus doing these equally. Otherwise, if you have an imbalance in here, it's just going to make that imbalance continue to grow and grow as you're doing this. But for those that don't have any of these major issues, what you'll be doing is exercising looking right and looking left in quick movements, and then up and down. Now, also a person who has problems with focus and attention is going to want to fixate on something or focus on an object and try and not take your eyes off it for as long as you can, because this is primarily going to help with those areas that are deficit or weak when you can't focus and concentrate. So you want to try and exercise that and go for however long that you can. Now, in terms of with dementia or problems with cognitive decline or memory issues, you want to start working on these vertical eye movements and specifically activating some of the head with it as well. because you want to exercise the frontal lobes and start to get some of these muscles to pull you back, because the body's going to drive what's going on in the brain, as well as the eyes are going to drive what's going on in the brain. So looking up and down in fast motions, as well as being able to track slow up and down, and also looking as far up as you can, looking as far down as you can, looking as far right, as far left, and even hit the corners as well, is really going to activate this full sensory system for your eyes and really stimulate your brain. So if you do that every single day, your brain function will improve. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.